Hi, I'm Dr. Amy Cherof. I'm a cataract surgeon at Marietta Eye Clinic. Today, I want to talk to you about cataracts, a very common condition that affects millions of people. A cataract is a clouding of the eye's natural lens. This can lead to many symptoms, such as blurred vision, difficulty seeing at night, and increasing glare. The good news is, cataract surgery is a safe and effective way to restore clear vision. In fact, it's the most common surgery performed in the United States. If you're experiencing symptoms of cataracts, I encourage you to schedule a consultation with us. Together, we can discuss your options and determine if cataract surgery is right for you. Now I want to give you a brief overview of what to expect during cataract surgery at Marietta Eye Clinic. Cataract surgery is an outpatient procedure, meaning that you can go home on the same day. It usually takes anywhere between 10 and 20 minutes and is performed under local anesthesia, so you'll be awake but comfortable. During the surgery, I'll remove your natural cloudy lens and replace it with a clear artificial lens called an intraocular lens, or an IOL. The new lens can even correct other vision problems such as nearsightedness or farsightedness, so you might not even need glasses. Recovery is generally very quick. Most patients notice an improvement in their vision within the first couple of days. We'll provide you with detailed aftercare instructions to ensure a smooth recovery. If you have any questions or concerns about cataract surgery, please don't hesitate to reach out to us. At Marietta Eye Clinic, we're here to help you see clearly and enjoy a better quality of life.